Okay, Professor, you are known as one of the best specialists in periodontal surgery and implant surgery in Europe. But for many people, you are controversial because the approach is different than some trends today. How could you describe the most important differences in your approach to implantology?
The biggest difference in our approach to implantology, I think what my partner, Dr. Zu, and myself are always trying to achieve is the best for our patient. And we want to make our treatment long-lasting. And so we try to think today not only in a prosthetic way, we also think mainly on a biological way. And we put a lot of emphasis that we create superstructure on implants in a way that they can be maintained from the patient very well, that they can be also maintained by the dentist himself or the dental hygienist, that he really can probe 360 degrees around those superstructures. In our opinion, this is the most important thing today, that we create something on implants which is long-lasting and which can be controlled and which also can be maintained. And when I look sometimes at our old implant reconstruction we have done ourselves, I have to admit that we also in the past created superstructures which were not maintainable 100%. So there we put a lot of emphasis also in the functional area and not only in the aesthetic area. We think also an implant placement in the function area should be done very, very precise. And only then you can achieve what we are looking for.
Yeah, talking about implants, because this is the third time I'm here as a Thommen implant user. And also one of the reasons I decided to come here for the first time was that you are the Thommen user. You use those implants for a much longer time than me. So what was the reason for the choice? Why Thommen?
Oh, this is a big question because this means a lot of different thoughts which brought us to this decision. Because let's start, according to many opinions, it's an old-fashioned designed implant because it has no platform switching included. But we think platform switching is not so important than what other opinion leaders think. The literature hasn't shown yet 100% that you really maintain better when you use platform switching. But when you use a design like Thommen, you have the possibility to probe the implant better than when you have a platform switched implant. And for us, probing is the most important parameter to follow our patients in the maintenance. In addition, it's for sure an implant which has the smallest screw head to fix the superstructure. So this gives us the opportunity to renounce completely on abutments and having still a nice aesthetic. So our superstructure in implant dentistry today is always a one-piece superstructure. And it's a one-piece and screw retained. And we have no more cementation because we know that 80% of periimplantitis is caused by cement leftovers. And so we don't want in our office to cement our restorations. We really want them only screw retained. And Thommen offers us there for sure the best option because the screw head is so small and therefore the access hole is very small, and this allows you, even in the aesthetic zone, on a lateral incisor to create in 98% of the cases a screw retained superstructure. So this is another very big advantage of the system. And then in addition, it's very simple to use. Very simple. You have 3 burrs to place a 4mm implant. This makes it also very convenient. The prosthetic parts, in addition, because of the small screw heads, are also hold very small. And this allows you to do things also very easy. And we like to have easy parts to use in our office. So this is briefly some advantages. but there are many, many other advantages, but it takes me too long to explain you everything.
Yeah, but generally the idea is, I agree also with this idea, and for these ideas, people from Poland come here to learn. I think it's the third group, it's the third time I am here, but you have more and more people from Poland. How do you find Polish dentistry, average skills on implantology?
I think Poland is doing very well. I'm very often in Poland. As you know, I also teach sometimes at the University of Krakow. I have a nice relationship with the university in Krakow, and I'm there twice a year for sure. And what I can see in the last, I'm doing this now 6-7 years already, and looking back now to this experience, I must say that you are on a really great track. I think you are improving a lot. The Polish dentists are very interested in new ideas. And what I can see when I go back, sometimes they have to present what they have done, what they have learned. They try to incorporate this new concept in their office, and I found it really marvelous how they incorporate new technology, what I try to teach to them also right away in their office, which is not so easy. It's always difficult to hear something from an opinion leader in Europe and then to use this technology in your own office. It's not so easy, and I'm really positively surprised how the Polish dentists react on my education there. And I think you are doing very, very good.
Thank you. It's not easy way, as you said, but also the problem is also to selling these technologies to our patients, because I think that the Polish market is a little bit different than German market. By the way, have you got patients from Poland here?
No, not many.
Not
No,
many.
honestly, no, we don't have Polish dentists. But you know, on the other hand, I must say the technology I offer and the concept we offer is also an easy concept, also from an economic standpoint. I know that it's also a question about economics. How much does it cost? We have to make it cost effective, our treatment. But this is also something I always think about. Now, not specifically in the aesthetic zone, I agree. The aesthetic zone, we do sometimes too many surgeries to achieve a little papilla there and a little papilla there, which costs a lot, absolutely. But in the functional area, we try to create concepts which are easy and not so expensive. When you look, what I just said, our new concept goes in the direction to do, as I mentioned, this course all in 2 steps. We extract the tooth, we place an implant, we take an impression at the same time, and then 3 months later we incorporate the final crown. This is something which is not only very convenient for the patient, what are the patient asking for, but it's also very convenient for you as a dentist, because when you see the patient for 1 crown on an implant twice, that's also very cost effective for both, for you and for the patient.
Yeah, it's a great goal. We all together go for this goal. And next training in Poland will be in this month. We'll see you in Warsaw.
Absolutely. I'm looking forward to a great meeting back at the end of April in Warsaw, and giving there a 1-day course, speaking about all our technology and ideas we have and what we are using in a daily business.
Yeah, I'm very happy because we'll meet again on this course in Warsaw. I'll be there, so it will be very nice to see you and hear your lectures again. It was a pleasure to be here, attend this course, and talk to you.
Thank you very much. Thank you.